Great day, everyone. I welcome each one of you for our today's webinar session brought to us exclusively by Swipe RX. I know that you will agree with me that this platform have provided limitless opportunities for us to nourish ourselves and profession even during these challenging times. I am Rosen Galera from Philippines, and I will be your moderator for today. Before we start, I would just like to briefly discuss our house rules for us to better understand and enjoy the exemplary topics prepared by our excellent speakers. So, for our house rules, we will mute your microphones while the session is ongoing. You may submit your questions via Zoom question and answer box. Q&A will follow right after the session. We will try to attend most questions within the given time. And most importantly, in order to get the certificate, you need to attend the webinar for at least 45 minutes. Instructions for the issuance of certificate will be announced at the end of the session. And lastly, sit back, relax, and enjoy the webinar. As we proceed, I would like to introduce to you the Swipe RX Community Director, Ikenor Hayati Hamdam, who will present us a more detailed and insightful features of the Swipe RX app. Ms. Hamdam, you may now take the floor.
All right. Thanks, everyone. Good afternoon for all of you guys attending this webinar in Indonesia, Malaysia, Philippines, and I also have some colleagues joining also from other countries in the Southeast Asia. Thank you very much. And I believe that we can use this opportunity to learn better about how the pharmacy professionals can have a very strong role in terms of the eradicating the tuberculosis, right? So can I have some feedback whether you guys can hear me clearly? Is it all
We can
good?
hear you.
Okay, cool. Right. So as I shared with you, it has been a very pleasure for us to have all of you guys. It has been an honor for the SwipeRx community, as we are the only mobile app in the Southeast Asia that uniquely designed for pharmacy professionals to connect one and another. So we connect pharmacy professionals to fellow colleagues in the largest pharmacy network in the region. And SwipeRx has a very strong vision to moving the pharmacies forward with our product and services that we believe it will bring pharmacy professionals to the position as the heart of public health of the society. So before you are enjoying our webinar this afternoon, I just want to invite you all to enjoy and explore our product and features from SwipeRx, where we mainly deliver to you the network features as well as the purchasing or pharmacy features. So with us in the SwipeRx community, we provide you the speedy modules for your professional enhancements, as well as any information that you are looking for being a better pharmacist, also having a better opportunity for your job or access to directory, as well as the networking with fellow professional pharmacists. And as for you that wants to business in pharmacy, we provide you the I would say the best solution in purchasing features that currently available in Bangkok area, as well as the Jabodetabek in Jakarta, and soon will be available to the nationwide in Indonesia. Okay, I think that once again, I would like to welcome with open heartly to all of you guys and see how we can best use this afternoon session from all of the experts that has been committed to share with all of us here on putting the role of pharmacy professionals to eradicate or the cure of the tuberculosis. So By this, I return back into moderator and have a great afternoon on the webinar.
Thank you very much, Ms. Hamdam. We are indeed privileged to be able to attain education, opportunities, and updates even with the use of our fingertips. Before we proceed, I would like again to remind everyone to stay at least 45 minutes in the webinar in order for you to receive a certificate. Moving forward for today's webinar highlight, TB or tuberculosis, as we all know, have been a long overdue global burden and is the leading cause of death of people with HIV, a major contributor to antimicrobial resistance and a double burden disease of those who are diagnosed with diabetes. That's why, in conjunction with the team for the World TB Day, the clock is ticking. We have curated an essential topic for discussion entitled Pharmacy Professionals' Role in Accelerating NTB Response. According to the World Health Organization, worldwide, TB is one of the top 10 causes of death and the leading cause from a single infectious agent. Every day, about 4,000 people die from TB and nearly 28,000 people become sick with this disease. Since the year 2000, an estimated 63 million lives have been saved with the global attempts to fight tuberculosis. This 2021 World TB Day has a theme. The clock is ticking. The world is running out of time to end TB. The light of the COVID-19 pandemic jeopardized NTB movement development, as well as to ensure equal access to prevention and treatment in line with the World Health Organization's goal of universal health coverage. As the community's first point of access to health information, pharmacy professionals have an important role in accelerating TB response by providing appropriate medical information on TB disease, further patient counseling, and promoting campaigns to end TB. Without further ado, I am very honored to present to you our distinct speakers from Asia for today's remarkable event. Here with us today from Indonesia, Mr. Ivan Surya Pradipta, from Malaysia, Dr. Alisa Alias, and lastly from the Philippines, Dr. Ethan Mendoza Haisi. I know, like me, you're all eager to feed your hungry minds with knowledge on how we can maximize our role and achieve the sustainable development goal of ensuring good health and well-being for all. To start with our first speaker, he works at the Department of Pharmacology and Clinical Pharmacy, Faculty of Pharmacy at Universitas Padjadjaran. He does research in infectious diseases, pharmacy, and clinical pharmacology. The current project is researcher on multi-drug resistant antibiotics and tuberculosis. He is also a doctor of philosophy in pharmacoepidemiology and clinical pharmacy and a master of clinical pharmacy. Everyone, please help me welcome Mr. Ivan Surya Pratipta. Mr. Ivan, you may now start your presentation.
Okay, thanks, Rose, for the nice introduction. Can you hear my voice, Rose?
Yes, sir, we can hear you clearly.
Okay, let me share my slide. Okay. Can you see also my slide?
Yes, we can see your slide.
Okay, yeah. Okay, thank you very much for the opportunity to present maybe my perspective about tuberculosis disease. And I'm happy to be here in this Swipe RX event. And today I'm going to share you about the future challenge of tuberculosis management. What should pharmacists do? As moderator mentioned that my name is Ivan Surya Pradipta. I'm from Department of Pharmacology and Clinical Pharmacy, Faculty of Pharmacy, Universitas Padjadjaran, Indonesia. And today I have position as one of the executive board of the Indonesian Researcher Network for Tuberculosis. And also I'm a research innovation and partnership manager at the Faculty of Pharmacy, Universitas Padjadjaran, Indonesia. As a researcher, I have interest on drug utilization study, including infectious disease, tuberculosis, antimicrobial resistance, and stewardship program, and also about the medication adherence because tuberculosis is related with the problem of medication adherence. That's why it's included as my interest on study on drug utilization study. I have to declare that I have no conflict of interest in this presentation. So this is my outline before we discuss about what should pharmacists do related to tuberculosis in the challenging situation. I'm going to share you about the burden of tuberculosis disease, and the second, impact of the COVID-19 pandemic on tuberculosis management. And the third, I'm going to share you the main problem of tuberculosis disease. And the last, we can discuss about how should pharmacists contribute in TB management. And also I'm going to share one of my projects that might support about related to TB management in Indonesia. So let me start from my first talk about the global burden of tuberculosis. According to the WHO report in 2020, tuberculosis is the top infectious killer in the world, where 1 million people die because of TB. And the leading killer for TB is the leading killer for cases of HIV and also antimicrobial resistance. And the data in 2019, there's around 30% TB patients were undiagnosed or not reported. So this is also our problem today. The problem is not only about how to manage the case, but how to detect the case and treat the case properly, and then hopefully they get the good treatment outcome. And from the WHO state that drug-resistant TB remain a public health crisis. There's 0 million people infected drug-resistant TB, but then sadly, only 57% people were successfully treated. Because if a person gets drug-resistant TB, I think the treatment will be more complicated than drug-sensitive TB. The patient should take anti-tuberculosis 9 months until 2 years with many adverse drug reactions that should be managed. So if you look at the burden of TB in Southeast Asia regions, I try to pick some example, Indonesia, Philippines, and Malaysia. We can see here, and we can compare with the global situation where Indonesia and Philippines are included as high tuberculosis prevalence country. And we can see the incident, the tuberculosis incident in Indonesia, about 311 cases per 100,000 population per year, and Philippines 500 something, and Malaysia 92. And if you look at the treatment success for MDR or RRTB, it's really very not good. And if you look at the data from Indonesia, it's only 45% people who get success treatment, and in Philippines it's only 58%, and Malaysia 60%. Regardless which country that has high prevalence TB country or lowest prevalence TB, from the data, WHO state that 40% of the global TB incident is in the Southeast Asia region. So this is our problem, and I think we have stand together to fight TB and to solve problem. And also from the previous publication that population migration also affect the prevalence of TB in a country. So I think we have solved this problem together to fight TB and to achieve anti-TB goal. So today we face a problem related to COVID-19. I think all the countries in the world get the pandemic about COVID-19. And of course, it's also effect on tuberculosis burden. And this is nice modeling that already created by Stop TB Partnership, collaborated with the university in US and also UK. And they took the data from India, Kenya, and Ukraine to predict the excess of tuberculosis case and deaths. But then they try to extrapolate the data into the global scope. So if you look at on the slide, for every month of lockdown, we'll produce around 600,000 tuberculosis case. And for every month of lockdown, we'll produce 126,000 tuberculosis deaths. So this is, I think, should be aware for all the people in the world, especially in the high tuberculosis prevalence country. So we will face with the problem about tuberculosis disease during the pandemic era. Why it's happened? So what's the current challenge and the essential problem that we face today? First, there's a decreasing case detection because there's a suspended active case finding and also limited access to healthcare facility because people today a little bit afraid to come to healthcare facility because they think healthcare facility is an epicentrum for COVID spreading. So they try to avoid to come to the healthcare facility. So it also make a difficulty to detect the case. And in terms of the laboratory, there's a reduced specimen referral and also limited access to the lab. In drug supply, there's problem about this about the procurement and supply chains, and also problem about stock out of the some drug. And treatment and monitoring facility-based dot also affected because many tuberculosis facility were used to manage COVID-19 problem. COVID-19 care, I mean, and also monitoring supervision suspended and also reporting delay because of the COVID-19. And in terms of human resource, many healthcare staff are repurposed for COVID-19. And today we can see that many healthcare staff is more focused on how to manage COVID-19 and how to vaccinate many people in each of country. So what a pharmacy can do regarding the problem? From the publication from ASIC Surya, they try to collect data from Indonesia. And they state that community pharmacy is the common facility to get first aid of tuberculosis medication. So many people come to the pharmacy when they feel coughing and also feel fever. And then they try to ask a pharmacy what's the medication that can be used based on their sign and symptom. But the problem is now pharmacists not aware about the sign of symptom of TB. So that the pharmacy just give the coughing drug and then just let away the patient. I think that's a good idea if the pharmacy can screen whether the patient can include as the suspected TB patient, and then if the patient based on the sign symptom show the sign symptom of TB, and then pharmacy can refer the patient to the healthcare facility or medical doctor. And pharmacy also is an accessible facility to do self-medication during pandemic because people say accessing pharmacy is more practical to solve the problem about their health status, because come to the healthcare facility is more risky. It's so risky to have COVID-19. So many people, for example, in Indonesia, come to the pharmacy asking about vitamin and etc., and also about the paracetamol, coughing drug, and then I think this is opportunity pharmacy to screen whether the patient or the people get suspect TB or not. And we also already know that there's a shifting paradigm of pharmacy from the product-oriented to the patient-oriented. So in terms of the patient-oriented, we have to responsible for all drug that we give to the patient. So we have to ensure whether it's rational or not. So that's the responsibility of pharmacy today. So according to those informations, I think community pharmacy has potential role on case detection, and the second, drug monitoring, and the third, communication, information, and education. But I found the problem from the pharmacies. Previously, I conducted qualitative study. I did interview study, and I did focus group discussion with community pharmacists. And my studies show that lack of TB awareness and knowledge from the pharmacists, because they think TB is not big problem, because there are not many tuberculosis prescription that find in their pharmacy. That's true, because like Indonesia, TB patient should refer to the community health center, which is not go to the pharmacy, which is in the private sector. So not many pharmacy get the tuberculosis prescription, and they feel that tuberculosis already handled by government. And the second problem is, I still find a statement about irrational dispensing of anti-tuberculosis drug, because there are many also pharmacists just give single medication for tuberculosis, like isoniazid. As we know, tuberculosis should give in the multiple drug, not in single medication. And the third, no integration or activity or system with the TB programmer. So pharmacies, as a sample, Indonesia still has not included in the TB program, a national TB program, in the patient-oriented way. So the role is only how to provide the drug and how to store the drug. But in another side, we see that there are a lot of potential activity that can be contributed by pharmacists. And the last problem is about low exposure of TB educational program, because maybe pharmacy are not included in the national TB program. So there are not many exposure on TB educational program that provide by the government. So the question is, can pharmacy contribute in TB management? I think I can say yes, because there are a lot of publication or evidence that already published. As example, I can show Daftari et al. They try to see how effective activity of pharmacy on tuberculosis screening and referral function to medical doctor and further examination. They try to create two group, intervention group and the control group. And in intervention group, they try to set up pharmacy to have some activity like tuberculosis screening and also referral function to medical doctor and further examination. And we can see on the slide, the result is TB diagnosis was 25 times higher in the intervention group, which is, it's very nice activity to increase case detection on tuberculosis patient. Another evidence also has been written by Jackman et al. They try to address latent tuberculosis infection treatment through a collaborative care model with community pharmacy and health department. And they set up activity pharmacies on evaluate drug-drug interaction, screen toxicity of the treatment, screen symptom of active tuberculosis disease, provide the LTBI treatment medication and monitor the patient take medication in form of DOT. And we can see the conclusion that high completion rate and safe administration of LTBI treatment can be achieved in the community pharmacy setting. And this is interesting result. If you look at on the slide that contribution community pharmacy can save the New Mexico Department of Health approximately 143 hours in patient contact time. So it will reduce the workload of TB programmer in managing tuberculosis case. And I think community pharmacy can also support the TB programmer in managing tuberculosis cases. And another evidence also stated by Karuniawati, they try to analyze impact of pharmacist counseling and leaflet on the adherence of pulmonary TB in lung hospital in Indonesia. They try to compare group that no counseling and no leaflet with the group that's given counseling from pharmacy and giving the leaflet. And we can see on the slide that there's significant compliance in taking medicine before and after intervention in group where the patient get counseling and leaflet. So this is very significant, the p-value. And also about the counseling, it's very significant if we compare with the group that did not get counseling and tuberculosis leaflet or tuberculosis information. So according to those information, so what's the strategy in accelerating TB goal from the pharmaceutical perspective? I think first we have to improve our knowledge and skill in managing tuberculosis case. And the second, integration pharmacy activity with the national or local TB programmer should be actively initiated so that public-private mix in pharmaceutical activities should be developed. So we have to discuss together with TB programmer what we can do to improve regarding problem of TB. And as I mentioned before, there are several potential role like case detection and also drug monitoring, and also improving knowledge and awareness tuberculosis patient in community pharmacy. And also, of course, a collaboration with TB programmer, professional organization, policymaker, researcher, and pharmacist itself is very essential to create the system and program that that solve the tuberculosis problem and that strengthen the role of pharmacy in TB management. And the fourth is about the research and development is needed, because if we want to accelerate our activity or evidence, I think we have to do research, because we can measure whether the intervention is effective or not. And from my perspective, there are two interesting topics. First, about the strengthening on TB tuberculosis cascade of care that involve pharmaceutical care. And the second, about the development of digital health technology that really help, especially during the pandemic situation. And for digital health technology, today, I and my colleagues are developing smart TB apps. We call smart TB application. This is a smartphone application that can be used for pharmacy to manage medication adherence individually, because from our previous study, we conducted systematic review on intervention of medication adherence, and we see that medication adherence is multiple problem. So the intervention cannot one size fit all. So we have to consider the individual problem. We have to screen what's the problem on medication adherence from our patient. And after we identify the problem, and then we have to intervene based on those problems. So the smart TB application try to guide the pharmacy to manage medication adherence. And in this smart TB application, there is interactive communication among TB patient, pharmacists, and tuberculosis programmer. And we have several functions. We call SIM car function: screening, intervening, monitoring, and administrating, and also reporting, and also counseling. So as you can see on the slide, there is several functions like screening patient, and also we provide a chat feature where pharmacy can discuss their problem about the medication. And also we also put the reminder, like SMS reminder, to remind patient for taking the medication. And for drug monitoring, we develop video monitoring, where we can ensure every day whether the TB patient take the antibiotic or anti-tuberculosis drug or not, and they can show the medication when they take the medication. I mean, with the video, so the pharmacy can really monitor whether the patient take antibiotic or not. And also we put some educational video and also article to improve knowledge and also awareness TB patient about TB treatment and TB disease. Okay, I think that's all my presentation. Thank you for the attention. I will give back to the Rose.
Okay, thank you very much, Mr. Ivan. Who, just to wrap up, and what just struck me with Mr. Ivan's presentation is that the involvement of pharmacists in TB screening help progress in effective TB screening and TB disease detection and the utilization of the digital technology through the Smart TB app. I think this is a very good study and innovation that we can adopt moving forward as we conquer against TB disease. Okay, once again, please feel free to drop your questions on the Q&A section and we will address it after all the presentation. So moving forward for our second speaker. So she is a clinical pharmacist at Pharmacy Department Hospital Tengkong Himaklang, Malaysia. Her specialties are infectious disease, clinical pharmacokinetics, and research and development. She also has a PhD degree in clinical pharmacy. She also obtained credentialing and privileging for pharmacokinetic clinical, and she also have credential and privileging for medication therapy adherence clinic for retroviral diseases. Please welcome with me Dr. Eliza Binti Alias. Dr. Eliza, you may now take the floor.
Okay, Bismillahirrahmanirrahim. Thank you, Rose, for the kind introduction. So let me share my slide. Can everyone hear me?
Yes.
Okay, thank you. Okay, Bismillahirrahmanirrahim. Okay, here I am today. Assalamualaikum and very good afternoon, everyone. So I'm here this evening to share our experience in Malaysia, how we handle the TB patients. So let's start with the TB statistic. WHO has reported about 10.4 million new TB cases with 1.4 million deaths worldwide. In Malaysia, the new TB cases reported in the range of 20 to 25,000 cases each year, with 6 deaths reported in average every day. So Malaysia is classified as an intermediate burden country with a notification case less than 100 cases for every 100,000 population. And the cause of death were mainly due to the delay in seeking medical treatments. So this situation is actually worrying as the public awareness on TB is still low, despite on the treatment regimen has been introduced and case detection has been improved. So WHO in 2010 has launched the Stop TB strategies with ambition to end the TB-free world by 2035. It comprises of the 6 components, includes high quality dot expansion, the healthcare system strengthening based on the primary healthcare, as well as to engage all care providers and to promote more research related to TB drugs. So with that, with all the main components of the Stop TB strategies are in place in Malaysia, we can see that a positive development in the National TB Control Program. So we can see from the TB mortality rate was stagnant between 4.5 to 5.5 per 100,000 population since year 2000 up to 2015, which is far below than the WHO estimated mortality rate. So we are doing well with this. On top of that, the National Strategic Plan for Tuberculosis Control has been launched by the Ministry of Health Malaysia under Disease Control Division, listed about 11 strategies to ending TB by year 2035. As highlighted, strategy number 8 is more related to our profession as a pharmacist. So what are the strategies intervention consist or include in the strategies 8? Number 1 is to provide a counseling on the TB medications. So we will include the strategies to include the pharmacists into the TB program. And the counseling of the TB medication is provided by the pharmacist for the newly diagnosed patient as well as the TB relapse patients. Moreover, there are also strategies to strengthen the ADR reportings, whereby the pharmacists will train the doctors and paramedics in ADR reporting in order to strengthen the pharmacovigilance of anti-TB medicines. And not to forget, to enhance the registrations of anti-TB medicines in liquid formulation for Malaysian markets so that we have more option to treat the TB patient, especially in the special populations. So what are the expected impact that we want to look at after implementations of the 5 years program of national strategic plans? We took 2015 as a baseline. So we look at the treatment success. There are lots of indicators, but one of the indicators is look at the treatment success for the new and relapsed TB. So take into consideration the baseline for 2015, expected for the treatment success rate to be increased from 79% up to 85% in 2020. So how we perform so far? So with regards to the treatment success rate in Malaysia, we can see that there are quite a numbers of huge increments from 67% in year 2009 up to 79% in 2008. It is still far below than the expected target as listed in the National Strategic Plan in Malaysia and also below than the world performance in 2018. Therefore, we have to double our effort in the way to achieve the target to ending the TB by year 2035. So when we talk about the TB care and prevention, it is actually a continuity of the service, not only by tackling the patient as inpatient when patient admitted, but also when the patient is discharged as an outpatient, and not to forget the community. It's like a holistic approach with the multidisciplinary team approach. So there are evidence conclude that socio-demographic and disease related actually factors that highly associated to the unsuccessful treatment outcome and mortality among tuberculosis patients. So this information is very useful information when we give the information or give the counseling to this targeted person. So more extra care can be given to those who are special population to ensure the good outcome in the future. So when we talk about the TB medicines, we are actually looking at the DOTS. So DOT is actually first is introduced by WHO in 1995. It is actually a very good approach to help patients to complete the TB therapy and also to prevent the TB from spreading to others. And also to reduce the risk of drug resistance as well as treatment failures and relapse. And Malaysia start to implement the DOT strategies for TB patients in the beginnings of 2002. So who is actually the best DOT supervisor that we can appoint? So according to the report, so family members, close family members and healthcare workers giving the best treatment success percentage, more than 85% show a good treatment success when they've been appointed as the dot supervisor. Not to forget, the NGO and volunteers also play an important role in giving as being a supervisor, dot supervisor, especially in those in community, for those who are undiagnosed active TB, as well as homeless, and also those who are ex-prisoner, for example. So what are the pharmacist's role in TB care? So as we know that TB counseling, refill medication and dispensing is like our bread and butter in each of our daily routine. So while doing these three activities, not to forget, the TB counseling need to be carried out during the induction and maintenance phase in view of the different regimen to be started. So when we do the TB counseling as well as refill medication and dispensing, we also can able to do a compliant assessment by doing a pill count and also assess the patient knowledge. We can start with the open-ended question, very simple question, just to ask the patient in a way how the patient take the medication and how many pills patient take every day, in a way to get the knowledge about the patients, and also do a pill count for the compliant assessment. Besides that, we also can do the assessments of the side effects, hence enhance the ABR reporting related to the TB medicine. So this is examples of the how we do the pill count and refill medications. Each of the TB patients will have their own diary. So the diary or the TB medicine drugs will have what are the medications as a patient given, when the medication is started, and who is the supervisor. So the supervisor can be the healthcare worker supervisor as well as the close family members. We will appoint the persons to make sure that patient take the medication every day. So when the patient is admitted to the ward, patient have to bring this TB medicine drugs, and the staff nurses, the healthcare workers will have to sign to know that, to acknowledge that patient is taking medication every day. So from here, we can detect that if the patient didn't comply with the medication given. So, as we all know that COVID-19 has struck us at the back end of 2019. So that also caused an impact to the tuberculosis services in the Western Pacific regions. Malaysia showed a 9% reduction of TB case detection in January to May 2020 as compared to 2019. This is actually quite an alarming to us because we are in a way to ending the TB-free world by year 2035. So what can we do to restore the tuberculosis services? As suggested by Chiang et al., there are actually lots of approach that can be carried out. So one of it is actually to scaling up the digital adherent interventions such as virtual counseling, virtual dots, also virtual assessment, as well as we can do a telemedicine through digital platform. So this is actually what we have currently in Malaysia. We have a guideline for the pharmacists how to manage the patients, the TB patient, as well as a newly published the guideline for the virtual counseling to be carried out. So these two guidelines is very useful to us to guide us how to give the best informations or best service to the patients. So let me share how we do the virtual counseling in my setting, and I think it's actually almost similar with other hospitals. So just to mention that our hospital is actually a non-IT based hospital. In setting up the digital platform is quite hard to us, but Alhamdulillah, we have managed to do it and it runs smoothly. So when there is actually counseling come from this respective ward, which is from the COVID ward, Sari-Ari or TB ward, there we send the counseling to pharmacy, the request counseling to the pharmacy, and we will do the screening. Screening will be done by the pharmacist as well as the counseling and reassessment. So what are the preparation that need to be carried out? So before we do the counseling, we have to give the consent. Patient have to give the consent. So we will do the briefing to the patients, and after patients agree with everything, they will give the consent, and we will start to list the appointment to the patients with the time slot. And not to forget, we use the device, whatever device that we have we have 2 tablets. So 1 tablet will be given to the patient for those who don't have a smartphone, and the setting up will be done by the staff nurse. Not to forget, most of the patients, the TB patient, is also come with other package disease such as diabetes, asthma. So we also need to prepare other devices to counsel the patient with the related devices. Then we start the counseling session virtually, and then as well as the reassessment. So patient need to show how they use the devices, or we will ask few questions to assess patient's understanding. After that, we will also share the counseling materials. Counseling materials can be given as an audio visual, so patient can scan the QR code or click to the links as listed. So according to the what types of counseling that we are giving to the patients. So we not to forget, for those who are not able to download it or we don't have the smartphone, we will give the quite and concise and colorful handout to the patients for the patient to bring it and read it furthermore. And also we have available in the soft copy. So then the documentations is very important, as this is a continuity of the service. When the patient discharged, we will discharge patient to other facilities. So documentation is very important. So when we do documentation, we will write on the piece of paper and we will pass to the staff nurses or any other healthcare workers to be put in the bed head ticket. And for our own pharmacy information, we have this pharmacy information system for all the counseling to be right in the BHT. Okay, so not to forget, if let's say some of the patient not really technology intelligent, so we will do manual counseling, face-to-face counseling, and not to forget for the outpatient clinic also. So full PPE with face mask, N95, and also face shield. Okay, so just to bring to attention to everyone that there's also overlooked risk for the tuberculosis in the community among the prisoners. According to the author, there about 7% had previously undiagnosed active TB among the prisoner, as well as 64.7% were unable to complete their TB treatment during the prison time because of the insufficient time. So therefore, the author suggests that the case finding strategies to be actively participate, as well as partnership between the criminal justice and public health treatment system are crucial to ensure that the ex-prisoner can continue the treatments after release. So what some other services or other things that we can help? So this is suggested that for the 24 hours pharmacy services in emergency department, 24 hours counseling, dispensing, and ADR reporting can be carried out. So the ADR reporting can be done online. So, and also clinic reminder to our hospital, we still remind the patient for the appointment visit to see the doctors or for the pharmacist appointment. So my last slides as a take-home message, as I told everyone, this is actually a multidisciplinary approach. It's like a holistic teamwork. So we need to ensure that the patients, family members, as supervisors, the healthcare workers, as well as NGO and volunteers should be together to work together to ensure that patient educations, as well as the motivation to finish the course of the treatment. And also prompt defaulted tracing to ensure that there is no undiagnosed active TB out there in the community. And for those who have a problem in socioeconomic, we will provide an assistance and also advice wherever related. So with that, I end my presentation. Thank you.
Thank you very much, Dr. Elisa. I want to commend the manual or guide created for the patient counseling dedicated for TB response. Also, the TB counseling kit that comes both in the form of both digital and paper. It was indeed a proof that the pharmacy profession do rise up in advancing clinical interventions and services, even during these challenging situations. Once again, I want to remind everyone to please drop your questions on the Q&A section, and we will address it after all the presentation. So to move on for our last speaker, she is a public health expert with more than 10 years of experience on health system strengthening, program management, strategic planning, monitoring and evaluation, and capacity building. She also has a medical degree from the University of the East Ramon Magsaysay Memorial Medical Center and a master's degree in international public health from the University of Sydney in Australia. She is currently the project manager of TB Innovations and Health System Strengthening Project. Please help me welcome our very own Dr. Eden C. Mendoza.
Thank you, Rose, for the kind introduction. Let me just share my screen. So I will be discussing the role of community pharmacists in presumptive TB screening. So why are we focusing on TB, right? I mean, you've heard the two speakers already, and they've established that TB really is a problem. And apart from the fact that we are commemorating World TB Day today, TB, as you can see in this slide, is one of the biggest problems in terms of infectious diseases that is circulating around the world. If you look at this map, I am actually showing to you the 8 countries that are contributing the 2/3 of the global cases in TB, right? So if you see your country in the map, then, or the name of the country in this map, then unfortunately, you are contributing to the number of TB cases globally. But if you don't see it, well and good. Unfortunately, the Philippines is one of them, which is the country I belong to. It is actually number 4, no, compared to the other countries that you see here. You have India as the highest contributor of TB cases. It has the biggest circle, if you see in the map. Followed by Indonesia, there's China, and then there's Philippines. And then the rest are smaller circles. Malaysia was presented to you earlier. Fortunately for them, they're not in the top 8 contributors of TB cases. So how else is TB a public health concern? One, it is 1/3 of the population has TB infection. And 1 person is infected with TB every second. So as I speak, somebody is getting infected with TB right now. And then more than 1 million people die of TB every year. And we're talking about every year. If COVID-19 has killed a lot of, or millions of people also, that's like during this pandemic only. But if you actually look at TB, this is happening for several years already, and it is still killing more than 1 million per year. So it is quite a problem. And then a lot of people believe that TB is a disease of the poor, but it's not. Everybody, like COVID-19, can be affected by TB. The old, the poor, the rich, the single, the married, the babies. So everybody can be affected by TB. And a lot of people think that it's an old disease, that, you know, we've been facing this for more than 2 decades now, at least in the Philippines. It's more than 2 decades or 20 years, and yet it's still here. I think that's the problem. It is still here. We have to eradicate TB, we have to eliminate TB, and yet we are not successful so far. So it is time to face the truth. The clock is ticking. We have to do something about it already. It is as terrible as COVID-19. It is as real as COVID-19. So let us all help each other to eradicate TB. And if TB is a public health concern, we never think about TB as an economic concern, but it is actually an economic problem. So if you look at the data, 1 out of TB patients and their household actually experience catastrophic cost. And when I talk about catastrophic cost, this means people are actually selling their houses, or selling their lots, their cars, because they're running out of money. They stop their children's education because they have to, pay for TB medicines. So it is actually catastrophic for a lot of households, especially here in the Philippines. And if you actually compute for the TB treatment, at least here in the Philippines, you spend around 10,000 pesos for the complete TB regimen. That is around 6 months of treatment. If you convert that to dollars, that's around $200. Okay, and we're talking about the drug susceptible TB. If we talk about the drug resistant TB, this would cost around 300,000. Does anyone, or at least any, for a poor family, I don't think that 300,000 would be something that's easy to get a hold of, especially when you have no savings and most of your income goes to food, shelter, education of your children. 300,000 is very difficult to come up with. And if you get the drug resistant TB case, then that's another catastrophic cost for that family, no? And then if a patient or an employee gets TB, imagine if he doesn't come to work. So approximately 3 to 4 months worth of wages will be lost because of absenteeism due to TB. No, so he doesn't go to work because he's so weak, he cannot perform his responsibilities or job. Then you lose your wages. And if you compute that annually, that's actually 20% or to 30% of your annual income. That could have been your savings. But since you did not go to work, you lost that opportunity, and therefore you lost that income. And if that patient dies, and most of them actually die during their most productive years, meaning these are the working population, you lose 15 years worth of income. You could have earned a lot during those years, but you died. People die. So they lost that income already. And then for the long-term effects, so if you have experienced catastrophic cost due to the treatment of TB, you would have sold your properties already. That would be difficult to get back, no, because it's very expensive. And then if you're trying to treat somebody in your family for TB, if you start saving your money, then you think about reducing nutrition. And if you have a lot of children, or if you have children, what happens to them if you reduce their nutrition? Because more money, or at least a bulk of your money, is going to TB treatment. You will, the children will then experience malnutrition. Okay, so that's another problem. That's a long-term effect for the children who will be losing their food, no, because of TB treatment for another member of the family. Discontinuation of children's education. Again, that's a vicious cycle for the poor families. They cannot get out of poverty because of TB, no? They are already poor, they're experiencing catastrophic costs, children stop going to school, they cannot get the right kind of work, or they cannot get the work that should have been, should have helped them to get better jobs, right? So that's another problem. So people do not think about TB this way. It's always a public health problem. But when you actually compute for the loss of income and the catastrophic cost that a lot of people are experiencing, it is actually a huge problem for a lot of people, especially the poor families. Okay. So what can the pharmacists do? Let me just show you that you're actually very important in the healthcare system. And this is just to show you the different building blocks of a healthcare system. You have the health services, the health workforce, health information, medical products, health financing, and of course, leadership and governance. And at the center of that, you as pharmacists. So when you talk about health services, these are you as the pharmacist are the medicine experts who deliver effective, safe, and quality medicines and services to achieve optimal health outcomes. So you're very important in terms of delivering these services. In terms of workforce, you're the most responsive workforce because you're almost everywhere. You can be, I will discuss this in another slide, but you're very accessible, and therefore it's a very good opportunity to provide the patient's needs, and you're actually one of the preferred health worker of a lot of patients before they go to the doctor. Health information, you're also the most accessible source of health information, because as I have said, you're everywhere, and that is a very good opportunity to share a lot of information about diseases, not only about TB, but even the lifestyle diseases like hypertension, diabetes, and medical products. You're ensuring the efficacy, the integrity, and security of all these medical products, even the devices, the vaccines right now that's coming out for COVID-19. You're there, you're always there. Health financing, what is your role for health financing? You make sure that patients are actually using their or taking their drugs rationally. You show them that there's a better drug. You show them there's a generic drug, an alternative drug. They don't have to get the expensive ones because some drugs are cheaper and yet effective as well. So this alone can help patients avoid catastrophic costs. You have a very good role in health financing. You provide cheaper alternatives, other alternatives that patient can actually access without going through the doctors anymore. You're there. And for leadership and governance, you have the opportunity to also change policies because of your experience with the patients and with what you see in the community in your practice. You have this opportunity to share your knowledge and change all the policies that are not helpful to the patient. No? So what is your role in public health really? What are the positive that we can see when we talk about pharmacists in public health? So number one, as I have mentioned before, you offer the best accessibility among the different healthcare providers. It's actually rare. In fact, we don't need appointments to see you. We don't need to get an appointment to buy our medicines. And you work in a lot of public settings, so many variety of public settings. We can see you in hospitals, in the drugstores, in the grocery, even in the public market, especially in the provinces. I've seen the small, what do you call this, mom and pop stores, and yet I see pharmacists there. So even if I go to the market, I buy my fish, I buy my vegetables, and I would need my medicines, I could get it there. And the pharmacists are also there. So it's amazing where we can find you and where we can access you. And it's these conveniences that create the large window for opportunity for providing public health services. It's a very huge opportunity that I believe you should be taking advantage of. And then you also feel that void, no? I can't see my doctor at a certain day. Sometimes he has a schedule. Sometimes they have a long queue of patients, and after a while you need to come home anymore. You have to come home, and yet you haven't seen the doctor yet. But I can reach you anytime, even any day, because some of you are open at 24/7, right? So that is one good thing about pharmacists. And you are in the ideal position to also provide information, as I have mentioned before. That accessibility makes you the best source of information. So that is why in the previous uh, speakers, they have mentioned that health counseling is a very important role of pharmacists. And your operating hours, like I mentioned, it's 24/7. So it's a very good opportunity, again, not only for health counseling, but for other services. And these are other services that I want to highlight. No, apart from health screening, you can provide immediate pain control. You can participate in clinical research, counseling and health education, even helping the patient to manage their diseases. If it's already been established that they have diabetes, they're maintaining their medications for diabetes, hypertension, and they happen to run out of medicines, they go to you. They don't have to go back to their doctors. They just go to you. You have an opportunity to also help in smoking cessation, alcohol and tobacco uh, prevention, drug abuse. So there's actually a lot of opportunities for you in public health. And this is not a comprehensive list. I hope that you do not limit yourself to staying in the pharmacies or in the hospital. There are a lot of ways for you to actually help in public health. So now that we are talking about TB, I just want to mention that when you actually do TB screening, I want you to memorize these 4 symptoms, just these 4 symptoms. And hopefully you can help send these patients who are buying cough medicines and antibiotics for TB to actually go to the health center first and make sure that they are actually properly diagnosed before they take these medicines. If they have a prescription, well and good, but please check if their prescriptions are actually within the right regimen. And you have the opportunity to take this education, because here in the Philippines, TB Innovations and Health System Strengthening Project, which is funded by USAID and implemented by Family Health International, has partnered with M-Clinica to develop a TB CPD module, which is available in SwipeRx here in the Philippines. So for those of you who are actually interested in knowing more about TB and how to refer TB to the health center, please stand by, and M-Clinica will be sharing with you a link to get this CPD module. And I'm talking about CPD here, so it's actually, you get 2 credit points from PRC for your license renewal, okay? So that's one of the good news I have for you tonight. So again, please memorize these 4 symptoms: 2 weeks duration of cough, 2 weeks of unexplained fever, 2 weeks of night sweats, and unexplained weight loss. If your patient is, or if the client is buying cough medicines or TB medicines, please try to ask them if they have these symptoms. And if they have any one of these symptoms, please direct them to take the self-assessment tool, which is another link that we will be sharing with you, or you can just refer them to the health facilities near you. Okay. And beyond TB screening, what I want to emphasize as well is we want you to refer these patients to the appropriate TB service facility. We don't want our patients to self-medicate. We want to avoid this. So if you can convince your clients to go to the health facility before they buy their medicines, especially for cough medicines and TB drugs, or antibiotics that is related for respiratory illness. Please try to make sure that they actually have consulted their doctors first before they buy their, before you sell them the medications. No, this would really help the government find our TB cases and improve the notification here in the Philippines and elsewhere. Actually, if you refer all these TB cases that are buying or taking their medicines or going to you for advice, please always refer them to the health facilities to improve notification everywhere. And then I think our previous speakers have already mentioned to you that TB treatment counseling is very important. So try to encourage all our presumptive TB patients. When we say presumptive, we're not sure yet. They have the symptoms, but we have not established or established the diagnosis that they have TB. So to convince them to actually stick to their treatment regimen once we have established that they will actually have TB, okay? And of course, good dispensing practices. Please do not dispense without prescription. So I think for those, especially maybe in the provinces, I still experience some pharmacists who, or maybe the pharmacy assistants who actually dispense antibiotics without a prescription. So hopefully we can try to avoid that, no? And this is what I was telling you about. The M-Clinica has developed this e-learning module for pharmacy professionals. It's very specific for pharmacy professionals. So the nurses or doctors are not going to be able to get their CPD units if they take this, because this is for you. And as I have mentioned before, it has PRC units. So please sign up. We can share the link to you later on via the chat box. And as the slide tells you, there's a limited slot. So please sign up. And this is just to show you the cover of the Swipe RX that you will be seeing when you sign up for the module. Okay, so it's a TB e-learning course for pharmacy professionals. You will be getting 2 credit units from PRC so that you will be able to renew your license. Okay, so unfortunately, this is only for the Philippines. So thank you. That's my last slide.
Thank you very much, Dr. Eden. So, as a former community pharmacist and a public health student, I can strongly relate on the pharmacist's role in the healthcare system, most especially on health financing and health information, because like what Dr. Eden have mentioned, TB disease is an economic concern. I am talking based on an experience. TB patients will always come in our pharmacy to buy only 3 pieces of their TB medications and will end up complaining that they don't have enough resources to buy medication good for the whole treatment duration. So, as we proceed for the question and answer portion, I would like first to thank all of our speakers for giving us a lot of takeaways for today's webinar session. And with that, we are now opening the floor for questions and open discussion. Again, with the interest of time, we will try to address as many questions as we can. So, for the first question, so any one of our speakers can answer this. With these 3 countries presented, how is extensively drug-resistant TB patients managed during these times? What they should do if they get infected with COVID-19? Is there any guidance? So from our 3 speakers, you are all welcome to answer this question.
Okay, hi. Let me try to answer this question. So,
Thank you, Dr. Elisa.
Okay, actually in Malaysia, we have one center that taking care of the TB patients. We call it as Respiratory Medicines Institute. So that is actually located in Kuala Lumpur. So that is actually institute that taking care of all the drug-resistant TB patients. So they are actually manage the patient very well. So in our hospitals or primary healthcare center, we only manage for those who are in first line regimens. So they are actually, we can state that they are doing well with their drug-resistant TB management. And if let's say patient is get infected with COVID-19, patient will be admitted in the COVID-19 ward. So we will treat accordingly as per complaints, and also the guidance is actually we have the Ministry of Health guides for management of COVID-19, and we're also following the Ministry of Health TB guidelines in managing TB patients. So you will work together.
Okay, thank you very much, Dr. Eliza, for answering that question. So, is there another questions from our speakers? So I guess we can proceed with the next question, which will be addressed for our speaker from Indonesia. So Smart TB app is really interesting approach to increase adherence of TB patients. Moreover, in pandemic situation, we agree that pharmacist intervention will increase the success rate of TB medication. Thus, the app has been used in Indonesia, and thus the app can substitute the health advisor or family member role in practice. And how about patients who doesn't know how to use smartphone, like the elderly or rural area? How to approach patients by case of individuality with the app?
Yeah. Okay, I think this is question for me, right?
Yes,
But
Mr. Ivan.
Smart TB app is still under development. So today we already get the prototype of the smartphone application. And this year we try to test on the community whether it's work or not. Or maybe there is some point that should be strengthened for the smart application, smart TB application. But this app cannot substitute healthcare advisor. The principle of the smart app, the smart TB apps, is pharmacists. The smart can be used for pharmacists to manage the medication adherence. So we hope that after TB patient diagnosis TB, and then medical doctor can refer to pharmacist, and pharmacist can manage about the treatment. So if there's problem about the diagnosis, pharmacist can also refer back to the medical doctor. But if there's problem about the medication adherence, I mean the significant problem like adverse drug reactions that cannot managed by pharmacists, and pharmacists can refer to a medical doctor. And also for family member, I think in this smart application also we try to include one of the close family member of the patient, because we still need the family member to support the TB patient. Especially we know one of the problem on medication adherence is about the stigmatization. So with the family member, we try to also communicate with this smart app about the medication progress in taking the medication, or maybe another problem. So family member is still included in the system, especially in the smart TB apps. So how about in elderly or rural area? Of course, this is the limitation if we're using digital technology. So not all people have ability to operate the digital technology adherence, but we should try, because if we already try and we try to implement, so they will learn about how to operate the smart TB. So we have to start for that. And then we can also try to give the module to support TB patient when they use the smart TB. So yes, there has a limitation, but we have to start to implement the digital technology adherence, because we think this is a very important approach during the pandemic era. Yeah, for individual approach in these apps, there's like algorithm for screening about problem of medication adherence. So first, when patient come to our pharmacy, and then we can screen what's the real problem, and then there's a lot of option because medication adherence is multifactorial factor. So we have to screen first what the problem, medication adherence problem in our patient. For example, we cannot intervene patient who problem with stigmatization with SMS reminder, because the problem is about stigmatization, not about the for taking antibiotic. So we have to screen problem of medication adherence, and every problem there's like guidance what should pharmacists do in that application. So that's my answer.
Thank you very much, Mr. Ivan, for the wonderful answer. I do agree that this is a very important question because we can see the future of the pharmacy profession in using health technology in advancing our TB and TB response. So we can move on for our third question. This question will be addressed for our speaker from Malaysia. How can Malaysian pharmacists ensure that DOT or direct observed treatment is achievable during this COVID-19 pandemic?
Okay, thank you, Rose. So like for examples, like during the COVID-19, we have to comply with the new norm, with the new SOP, so that we can do like what we are practicing currently is we do a clinic appointment basis. So we try to reduce the crowd in the clinic, so patient come to the hospital according to the time slots. So on top of that, as healthcare workers, we have to wear a full PPE with face shields and N95 to avoid that patient the virus to be transmitted, as well as the TB also. And physical distancing with the new norm. And also we try to fully utilize the digital platform that we have. So we can do virtual dots with the patients during the telemedicine, for example, or during virtual counseling with the patients. So patient also, we carry all the way everywhere the TB medicine diary. So we use that as a mediums of the communication if patient go anywhere else. Okay, I think that's all. Thank you.
Thank you very much, Dr. Alisa. We can now proceed to the fourth question. This is to be addressed by our speaker from the Philippines. Do you think that there is a possibility in the future where Filipino pharmacists can directly screen presumptive TB patients in the pharmacies?
Yes, actually, it's not even, we're not going to wait for the future. We've done so many, how do you say this, engagements with the pharmacists, especially for TB. During the previous project that I was involved in, it's also a USAID funded project. With Philippine Business for Social Progress, we have engaged a lot of pharmacies to help us in screening TB patients and refer them to the health facilities. So we did that in the previous project, and now we also are doing that. We actually use the Swipe RX app. There's a referral system that was developed by mClinica in the Swipe RX, and we ask the pharmacist to use this app to refer patients to the health facilities. We have pre-identified health facilities where these pharmacies can refer patients to, and it actually produced very good results. Around 50% of the patients that were who actually reached the health facility and were tested for TB turned out to be positive for TB. That's 50%. So there's a huge opportunity in there. We hope that after you take the CPD module in the Swipe RX, you learn more about TB and you help us refer patients to to the facilities. Actually, you are also being recognized as referring point. So if the DOH is going to record where did this patient come from or who referred this patient, we identify, there's a line there that it came from Pharmacist. So you are slowly being recognized as one of the most important sources of referrals for TB patients. So there really is a great future for pharmacists there. Thank
Okay.
you.
Thank you very much, Dr. Eden. I really agree that the Swipe RX played an important role in advancing our pharmacy services and being known on how we can advance the NTB response. Okay, can we move on to the question number 5? So this can be answered by any of our speakers. For some instances, is it possible for an individual after completing the TB treatment to get the infection again, and will it be worse in the second time? Taking note that there are lung scarring from the previous infection, and also how long does the scarring heal? Is there some special treatment for the healing?
I think I can answer that. Okay, so for the first question, is it possible for an individual after completing TB treatment to get infection again? Yes, it's very possible. You may even get the susceptible kind, TB, drug susceptible TB. And then after that, you get the drug resistant TB. Because when you get TB, you do not develop immunity like when you get measles, when you get chickenpox, you don't have to get this disease again. But for TB, you can get it as many times as you can as long as you're alive. And as long as you are exposed to a lot of people with TB, unfortunately for the Philippines, we're one of the biggest contributors of TB. And therefore, even if you get treated and you get cured, you would still, there's still a possibility of getting TB. You won't get immunity, okay? And then if there's scarring in previous infection, that's it, you get the scar, okay? It will not go away, but it doesn't mean that you're going to die as well. So a lot of people has been cured. Even our TB survivor who happens to, if you know Mildred Pancho, who was one of the most popular TB survivor, she got extremely drug resistant TB. So this is the worst kind of TB. Her lungs were actually operated on and they removed a section of her lungs, and yet she still survived. So a lot of people who get drug-resistant TB can survive, but you would have that scar forever. You'll have that scar until you die. Is there a special treatment for healing? There's always the regimen. You have to stick to the TB treatment regimen. It depends on whether you have the susceptible kind or the drug-resistant kind. For drug-resistant TB, you would be taking it for 9 months to 20 months. It depends on the kind of drugs that the doctors would be prescribing to you. But it's special in such a way that you would be getting all this menu or all these several drugs. It's like one plate of medicines that you will be taking every day until you finish the 9 months or 20 months, depending on your regimen. So there are no special vitamins. If that's what you're looking for, there's none. There's only the antibiotics that are already established to be effective for TB. Please do not try to take other medicines that are not for TB, hoping to cure your TB. So if the doctors prescribe you this specific medicine, stick to that. Do not add more antibiotics or other medicines because it's not gonna help. But obviously, healthy food, healthy lifestyle will also help boost your immune system, and therefore it would be important to maintain all this healthy living, healthy lifestyle, healthy food in order to help you recuperate and fight the infection. Otherwise, if you always drink alcohol, if you smoke, it will worsen the case, and therefore it would be difficult for you to fight the infection for TB. Thank you. That's it.
Thank you, Dr. Eden, for that very insightful answer. Okay, I think we'll be addressing two more questions, but it will no longer be projected on our screen. I'll be reading the questions, and for this question, anyone from our speakers can answer. So, should we as pharmacists be cautious to when handling TB patients when giving education to them? What can we do without offending the patient about using masks everywhere for precautions?
I think that would be, um, it's a challenge, really. There's always a stigma around TB. And therefore, I will be throwing the challenge back to you to think of creative ways to share information about TB without offending the patients. We will provide you with all the information to know about TB, what is how to get how do you get TB is what I'm trying to say. How do you get TB? How is it transmitted? We will provide you with all this information. In fact, as I have mentioned before, we have added this in our CPD module, so please try to avail of that. And if you get all this information, I challenge you to frame all this information and share it with the patients without actually trying to offend them or make them realize that it's actually important for them to seek medical help if they have all these symptoms. So I am throwing the challenge back to you to think of creative ways to remove the stigma. Even if you wear, yes, I would advise that you wear a mask if the patient is coughing, or if the patient is not wearing a mask, try to convince them to wear their mask so that they don't spread TB as well as COVID. So because both diseases spread in similar ways, you know, when you cough and you sneeze, you release the virus of COVID and the bacteria from TB. So that would be my answer.
Thank you very much, Dr. Aiden. I think, is there any addition from our different speakers? We want to hear also your insights about how we can provide education without offending our patients.
Okay, I think I agree with Dr. Mendoza. So just to add in, I think in the COVID era, everyone aware about all the normal is actually live in the new norm, so that everyone is aware what the do and the don'ts, so that with the digital platform, for example, so we can actually continue to provide the good service to the patients without offended them.
Okay, thank you very much, Dr. Elisa. So I think we can move on our seventh question that will be addressed by our speaker from the Philippines. So what if the suspected patient refuses to be referred to the health center given the manifestation of the symptoms discussed earlier? What is the best thing to do?
That's actually another challenge. You know, we've heard this complaint several times that a lot of patients refuse to be referred to the health facilities. We call it pasaway. They don't believe that they have TB, or they're in denial, or they just totally refuse to go to the health facilities. And again, I mean, I myself is running out of ideas to, you know, to how to convince this patient. Even good information, quality information, no matter how much you explain all these wonderful data about TB and how it's being transmitted, you will still encounter this type of patient. So I think the best way to actually convince them is just give them options. If they don't want to be referred to the government facilities because it's hot, it's not air conditioned, there's a lot of people queuing up in those areas, they are not treated very well, the nurse is always yelling, is always angry. Yes, we get that a lot of that kind of complaint. You can actually refer them to private patients. We are to private doctors. We are now encouraging patients to go to their private doctors. We have this bad idea before that doctors are, or the private doctors are one of the sources of drug-resistant TB because they don't manage their patients very well. They don't ask the patients to come back to complete their treatment. But nowadays, we've reached out, the government has reached out with the private doctors. They have been trained about how to manage TB properly, the right regimen to prescribe. There's a lot of coordination and collaboration between the government and the private sector. So if one of the reasons why patients do not want to go to the public sector is because of the long lines and bad service from the government health facilities, then another option is to send them to private practitioners. That's okay. We've already reached out to them, and I think things are already improving. Now, if there are other patients who actually are just hard-headed, they are very difficult patients, I am going to throw again the challenge back to you. Please look for other ways, creative ways to really convince them. It is very important to convince them. Otherwise, they will be continuing to spread TB. And right now, we can't afford TB, COVID at the same time. So a lot of people are losing their income, are dying, not only because of COVID, but also of TB. It's a very huge burden to carry for the Philippines. So we are trying to look for very creative ways. Even me, I couldn't find any more. So please help us think of good ways to convince them. Thank you.
Thank you very much, Dr. Eden. I think we're very challenged on that, most especially our attendees right now. So I hope that everyone will take note on that and you will take the challenge in order to progress our end TB response. Okay, for the last question, this question will be addressed by our speaker from Malaysia. For poor families, is there any help or intervention coming from private or government organizations in managing TB medication adherence? Is patient counseling free in Malaysia?
Okay, thank you, Rose. So yes, the patient counseling free in Malaysia for the government facility. So we have actually our hospital as well as a primary healthcare clinics. So we provide a free counseling for the patient for the induction as well as the maintenance phase. Okay, so for the poor family, so just to share that Malaysia of Health policy, we will provide free medicine for the first line regimen patients. So actually there's no issue for poor families or those who can't afford to buy the TB medicine outside. So actually most of the TB patient, we will manage it under government facilities. So this is actually something that we can help them by providing the free services as well as the free medicine to the TB patients. Okay, thank you.
Thank you very much, Dr. Eliza. It is indeed great that there are free patient counseling in Malaysia. I think this will really help advance our response in NTB. Okay, unfortunately, that would be the last question we can accommodate due to time constraints. So for more questions or clarifications regarding the webinar, please send an email to hello@swiperxapp.com. So we will be providing that email address later on our screen. It is indeed our fight against TB is still a long journey, but even a single step towards our goal to end it will help bring its completion. Let the knowledge we gather today become the voice of the pharmacy profession to actively take part in ending the burden of TB disease, not only in our respective countries, but to the attainment of the Sustainable Development Goal and ensuring good health and well-being for all. Before we end this webinar, I would like to discuss to you how to get the certificate. So first, SwipeRx will send an email to those who have spent a minimum of 45 minutes in the webinar. To participants with less than 45 minutes will not receive a certificate. You are required to fill out the feedback form by clicking the link provided in the email. Make sure that you have the SwipeRx account. Third, and the most important one, is that make sure that you're connected to a stable internet network while answering the feedback form. Do not leave or close the Swipe RX app, because closing or leaving the app while answering the feedback form will be marked as a failed attempt. There's no score requirement to get the certificate. You just need to complete the feedback form. You will get the certificate within 48 hours after completing the form. For more information, questions, and clarifications, you may send an email at hello@swiperxapp.com. So once again, I want to thank all of you for attending today's webinar session. Stay safe, strictly adhere to health protocols, and be an active advocate of change.